In today's quick video, let's talk about the herb Magnolia. Let's dive in. Magnolia has been used in traditional Chinese medicine for a very long time, and there are a couple different species that are used. One is known as Ho Po, and the other is known as Xin Yin Hua. In Chinese medicine, Magnolia helps to promote the flow of qi, it can help relieve dampness, and can also help to resolve stagnation. Because of these properties in traditional Chinese medicine, it's often been used for abdominal issues, so things like gas and bloating and constipation. It has also historically been used for things like anxiety and depression as well. And when using raw herbs in traditional Chinese medicine, depending on the decoction, we see about 3 to 10 grams being used. Now, recently, there has been more and more research on this herb, which is really exciting. There's been a lot more research in using it for anti-cancer purposes, as well as for things like anxiety and depression. When using Magnolia, we're generally using the bark or the flower bud. And there are many constituents in Magnolia, but the most popular ones are, I'll leave them on the screen because I don't want to butcher the names. Now, most extracts that you get or most commercial products are going to have a standardized ratio of these or a standardized amount of these containing either from 40 to 90% of these active constituents. Let's talk about some of the properties. Now, Magnolia is antimicrobial. We've seen it used in things like gums and toothpaste because it helps to prevent plaque and cavities, and it disrupts that biofilm of bacteria. And it's also thought to be helpful in the prevention of gingivitis. I mentioned earlier, there's a lot more research now going into the anti-cancer properties, and we think one of the ways that it's doing this is interrupting the signaling pathways of different types of cancers. Magnolia is also anti-diabetic, and this research is more done in animals so far. But we see that it can help to lower blood glucose, it can help prevent insulin resistance, and also helps glucose uptake into different types of fat cells. So we're seeing it used more and more in things like the prevention and treatment of diabetes, especially with insulin resistance. Magnolia is also anti-inflammatory and an antioxidant as well. In some studies, it has been shown to actually modulate pro-inflammatory genes, actually down-regulating them and pushing you towards more anti-inflammatory pathways. And it also works as an antioxidant. It helps to prevent the production or the formation of different types of free radicals or reactive oxygenated species. Because of this mechanism, it's also used in the prevention of cardiovascular disease. It can actually alleviate the effects of oxidized LDL or even help to prevent the formation of oxidized LDL, which is generally our bad cholesterol, which is generally involved in the mechanism of promoting atherosclerosis. So in that respect, those anti-inflammatory properties make it very helpful in the prevention of cardiovascular disease. We often see Magnolia used for its respiratory effects as well, and this is a really popular one with different types of Chinese herbs. We often see it used in the treatment of asthma as well as allergic rhinitis and also sinus congestion. And this one is really popular in traditional Chinese medicine. In this area, some studies have shown that it actually helps to increase bronchodilation, which would help with breathing and the chest tightness with asthma. And it's also thought to help suppress different types of type 4 allergic reactions as well. Now, I mentioned earlier it has some GI effects, and we think that this is because it also acts as an antispasmodic, helping to relax the intestinal tract. Now, another popular area, and again, there's more research coming in this area, is using Magnolia for things like anxiety, depression, and even resilience or tolerance to stress. In the case of anxiety, we think that Magnolia is actually working on GABA receptors to promote that feeling of calm and helping to reduce the feeling of nervousness. And when using Magnolia for things like depression, we think it's related to altered serotonin turnover in the brain. But again, more research is actually needed. And when it comes to working with stress, the mechanism's not quite known, and the studies are actually a little bit conflicting. There are some studies that show that Magnolia has been helpful in actually reducing the amount of cortisol being produced, and there are some studies that actually show it may increase the amount of cortisol being produced. So very interesting. You'll often see Magnolia in different types of anti-stress formulas, but it's usually also mixed with other herbs as well. So how do I use Magnolia? Well, a couple different ways. In office, I tend to use this in formulas for asthma and sinus and allergies. And again, it's often in combination with other herbs as well and other mast cell stabilizers, especially for things like sinusitis and allergic rhinitis. And I also tend to use it to help with the effects of stress and also things like depression and anxiety as well. And again, it's usually in combination with other herbs. So one of my favorite formulas is a product called Cortisol Manager. It actually has Magnolia, ashwagandha, phosphatidylserine, all things that I've talked about. So if you want to see those videos, you can check out this playlist. But if I'm using this herb on its own, generally dosages are going to vary from 200 to 800 grams daily. Dosage and duration of how long you're going to be on this one is actually going to depend on what are we treating it for, because it does have so many uses. And of course, what other medications are you taking, as well as other herbs. Now, this one does not have a huge side effect profile, but again, this is not one that I would use in pregnancy or during lactation. I hope that this video is helpful and that you learned something. If you have experience with Magnolia, go ahead and drop it in the comments below. Otherwise, I'll see you in the next video. Bye.